I'm Officer Josh Silverman with the Portland Police. I've been with the Bureau for just about 4 years now, and just a couple months with the Behavioral Health Unit now.
My name is Cindy Hackett, and I am a Project Respond clinician who is assigned to the Behavioral Health Unit, and I have been working with the Mobile Crisis Unit for about 3 years now.
The person we're meeting today, he is a referral from Patrol. Basically, Patrol's been having increased contact with this person, and it's their belief that this person is suffering from some sort of mental illness that we don't know what. And so because of that, we're trying to intervene before contacts become more increased and possibly negative. Like that. And the news people were really, really helpful with that, like keeping him on the line. This was like an in-the-moment thing. But generally, we don't get any calls for service, and that's not our goal. Our goal is that we do the follow. We read the reports from the previous night or from a few nights ago and say this person is either a very big chronic problem and needs follow-up, or this person is a safety risk and we need to follow up on them. And we prioritize the safety risk over the chronic problems, but try to head them off before things escalate even further.
Medical center, somebody said, I don't know what they were involved. He just happened to mention we were at coffee this morning because we were talking about it. But yeah, he was bothering everybody waiting to get stuff at the church.
He's, as far as we know, not currently in crisis. This is supposed to be a very low-key meeting to just see where he's at, to start building a rapport, relationship with him. Right now, I just know him based on police reports, and police reports are only going to reflect him in crisis, only him at probably at his worst. So this is going to be a good opportunity to chat with him in a way where I'm not coming to arrest him. I'm actually here with some things to offer and to listen. My goal also is to keep you from interacting with the police, frankly. I mean, you should be able to do your thing and not have to deal with the police. So why do you think you keep running into us, besides today?
I've had the wrong attitude.
Yeah? The behavior he was exhibiting in front of us did not rise to the level that we could have placed him on a police officer's hold. Even though the behavior everybody's mentioning was holdable behavior. So it was successful insofar as we finally got a good assessment on this guy. We were able to have I think a fairly decent rapport with him, a good positive initial first contact. And then that way we can get in front of any potential problems in the future.
We just got a call to go back. Yeah, it's pretty rude.
It was full of bed bugs.
What about
the fact that he was calmed in the minute we left, that we have reports of him like chest bumping people, challenging people, and then him standing, then sitting, then lying down on the ground, then punching himself in the stomach to show how strong his sternum is. So just the floridness of it, it's more colorful than our conversation with him on the street. So this is a good first step. We solved a short-term problem, which was that this person was escalating in their current situation, causing multiple police calls, and hopefully this will stabilize him. Hopefully in the moment he's not going to, when he gets released, he's not going to continue the exact same cycle of getting in people's faces and getting aggressive and causing disturbances. Holds are a tricky thing where we're depriving somebody of their liberty and they haven't committed a crime. So it's something that you don't want to be cavalier about. You want to be real thoughtful in making that decision. And if possible, you want to get some buy-in from the individual. So legally, I'm making the choice that they're going to the hospital. But if possible, I want them to be part of that decision. So in this case, we were pretty lucky in that the individual agreed to go to the hospital, whether or not he had full insight into why he was going to the hospital or what parts of his issues he was going to get addressed. I don't know how much insight he had, but he was willing to go to the hospital.
1 southwest of Morrison on a warrant follow-up.